Welcome to another episode of PHI, Public Health Impact. I'm Phaedra Corso.
And I'm Cham Dallas, and today we're going to talk with the University of Georgia College of Public Health Workplace Health Group. And we're going to talk about their involvement in the business community and with the improvement of worker health.
Cham, I know you and I spend more time at work than we probably do with our families, so it makes sense to have health and public health brought into the workplace.
Yeah, there's the Centers for Disease Control tell us there's over 140 million workers in this country that spend a third or more of their time at work. So why not use that to improve health instead of knocking it down?
Right, and employers really should care about this issue because it results in higher health care costs for them if they have an unhealthy workplace or workforce, and also more productivity losses. You know, think about how many days you stay home from work sick. If you're healthy, you're not staying home from work.
So it only makes sense that we would make the effort to intervene and to help workers in the workplace, and then that will have a ripple effect in the rest of the community, especially in the home.
Well, let's find out what we're doing here at the University of Georgia in the area of workplace health promotion.
We now have with us Dr. Mark Wilson, who's the Associate Dean for Academic Affairs at the University of Georgia College of Public Health, and he's the Director of the Workplace Health Group. Mark, when did this Workplace Health Group get started here at the University of Georgia?
Well, a colleague of mine, Dave DeJoy, who is also in the Health Promotion and Behavior Department, saw that we have very similar interests that revolved around workplace health. Me coming more from the health promotion disease prevention side, he coming really from the occupational safety and the injury prevention side. So we decided to link forces, if you will, join together and started the Workplace Health Group in 1999. The group really has a couple of functions, one of which is to train our students, and we have a number of students that we'll bring in and train them in research and implementation methods. But we also are actively involved in conducting research and consulting with a variety of organizations. I mean, for example, one organization that we've worked with most recently is the Association of Commissioners of County Governments for the state of Georgia. And they are really the county commissioners for all the counties throughout the state of Georgia. Been very interested in workplace health, but they don't really know where to get started, so we've been advising them on how to get going.
Well, maybe I should ask you first, what is workplace health?
Organizations have realized for some time now that healthy employees are absent less from work, they are more productive, they are less likely to leave the organization or turnover, they are generally more satisfied, there's higher levels of morale, they are more committed to the organization, and probably most importantly, and it makes common sense, if you're healthy, you don't go to the doctor, you don't go to the hospital, so you save on healthcare costs. So there are significant reductions in the healthcare cost for individuals who are healthy, and the healthcare cost is a very large ticket item for organizations. The University System of Georgia spends about $600 million a year on healthcare for its employees. University of Georgia, about 20% of that system, we spend in the area of about $100 million a year on employee healthcare costs. So it's something that organizations are very aware of and very concerned about.
So that's a pretty staggering impact here at the University of Georgia. Is that also outside the university in other parts of Georgia, that same kind of impact that workplace health has?
Absolutely. That's true with any organization, and particularly those organizations that offer health care benefits to their employees. The idea behind workplace health is that if we teach them how to take care of themselves, if we can help them manage some of the health risks so that they reduce their weight, so they're more physically active, so that they don't smoke, so that they're careful what they eat and what they drink, then they're more likely to be healthy, not use the healthcare services, and then as a result incur fewer costs associated with it. So it's very much a public health, health promotion, disease prevention approach. We want to keep them healthy, which will keep them out of the doctor's office.
Well, tell us a little bit about how your university research group, the Workplace Health Group, is actually crafting these programs for improved health?
Well, we're doing so on a variety of levels. I think on a policy level, right now, I am working with the VP for HR, Vice President for Human Resources for the University System of Georgia. The entire system, again, is very concerned about this, and the VP for HR, and it's her primary responsibility, is very interested in looking at what type of employee health programs they can undertake for system employees to reduce some of the burdens associated with some of these particular costs. So I'm consulting and advising with that particular group to establish policies for the entire system. On an individual level, we have offered individual behavior change programs to a variety of segments across UGA's campus. Most recently, we offered a weight management program to parking services employees as part of an intervention designed to help them manage their weight. That piece, that intervention, was one of many that we've done, was part of a larger grant that we received from NIH that we're working with some statewide organizations. So very typically the programs that we will conduct with university employees we use as pilot programs that in turn will go external to the university for either state or national organizations that we work with in similar types of programs.
Well, we all know, and increasingly over time now, external research grants are what make research run at a major state university like the University of Georgia. Why don't you tell us now about your extramural research grant program that you've involved in?
Well, the most recent one that we have is a grant from National Institutes of Health, and is focused very much on the translation of a effective program, a program that was found effective in clinical settings that needs to be translated to worksite settings. Public health is very interested, and one of the hottest topics in public health right now is this notion of dissemination or translation. Can we take programs that have been found effective in a hospital's clinical setting? Can we take programs that were found effective in a community setting, and can we translate those to a different setting, and do we get the same effects when we do so? The diabetes prevention program was a program that was tested in a clinical setting in a large randomized trial and found to be effective, but had never been actually put in a field-based setting. And in worksites have been slow to jump on the translation train, if you will. And so we thought this would be a unique opportunity for us to look at this unique program and see if we could take what was found effective in a clinical setting and make it equally effective in a broader public health setting.
All right, well, thank you, Dr. Mark Wilson, the director of the Workplace Health Group. And now we're going to see some of his partners, the community partners that he's been working with, and the members of his team in this cutting-edge research in workplace health. I have Heather Padilla here with me today. Heather is the project coordinator for the Workplace Health Group here at the University of Georgia. Welcome to the show. You know, Heather, before we talk about your role in the group, let's hear a little bit about yourself and why and how you came to the University of Georgia.
Sure, I'm a registered dietitian. I did my undergraduate and my master's degree here at the University of Georgia, and I started my career as a clinical dietitian working in a hospital setting. And I was working with patients to help them manage their chronic diseases, and I quickly found that I felt like we were missing something. I felt like we needed to better understand how to help patients change their behaviors. So I really wanted to go back to a research environment, an environment that allowed me to explore those reasons and to better understand how to help people change their behaviors to find their health.
Well, the university is certainly a great place to get into those depth of research questions. Now tell me, how does the research direct the health group, the Workplace Health Group programs?
Well, we usually seek funding from the Centers for Disease Control or National Institute of Health, and then if we're fortunate enough to receive a grant, our wonderful team of researchers, staff, and students work to develop a plan to carry these programs out to worksite partners.
So, you've received a extramurally funded research grant from the National Institutes of Health or the Centers for Disease Control and Prevention. How does this transition into working with a company which has workers there that you're trying to improve their health?
Sure, yeah, that relationship starts very early. Actually, we usually start to develop a relationship with a company or organization before we apply for that funding. We meet those individuals at meetings, or they contact our group, and then we have a mutual interest in worksite health, and we then seek the funding. If we're fortunate enough to get that grant, we then work with a wellness coordinator or a staff person within the human resources department at the company to access the various levels of management, to work with the employees to understand the culture and context of their work site, so that we can bring programs to them that will be best received by that work site.
Okay, you mentioned participants. Who are they? Who are these groups that you're working with?
Well, the participants are like you and I. They're employees of these companies, and they're trying to manage the multiple responsibilities in their lives. They're spouses, they're employees, they're supervisors, they are mothers and fathers, and they're trying to maintain their own health while caring for a lot of other people and a lot of other projects.
Okay, what does that look like? You've got these workers, you're coming in as a researcher, the workers are coming in. What does that look like when they participate in a workplace health program?
Well, the participants in one of our largest projects right now are working with health coaches. So we have health coaches that contact the participants either by phone or in a group setting, and they teach them how to eat healthy and to be more active, but more importantly, they try to find out what may be getting in the way of them doing those things. They try to understand what's happening in their lives and find ways for them to overcome the barriers to making those changes in what they eat and to making those changes in being more active.
Well, tell us, how do the people in the state of Georgia benefit from this? Give us some examples, maybe.
Well, in our current project, we're working with city county governments in the state of Georgia. So these work sites are here in our state, and the work sites are within the communities that we live in, and the employees live in those communities, and their children go to the schools in those communities. So if we can improve the lives of the employees, and that can carry over into their families, we can improve the health of the community.
Well, Heather, if any of our viewers want to engage with the Workplace Health Group here at the University of Georgia, how would they go about doing that?
We have a website, and contact information for myself or Mark Wilson is on that website. They can email or call us, and we can talk about our interest.
So this shows us how the workers and the companies and the researchers all work together to improve workplace health. Now we have Scott Dills, who is a first-year Master of Public Health student in Health Promotion and Behavior. You know, Scott, why don't you tell us a little about yourself and why did you come back to school?
Okay, well, I graduated from Furman University in 2007 with a degree in health and exercise science, and I spent a few years working, but realized that I was deficient in a few areas to further my career, and decided to return to the MPH program at UGA.
Well, Scott, tell me about the work that you were doing before you came back to graduate school.
Was working with a doctor's practice to engage their patients into an online wellness program, and we experienced several challenges with that. And working with employer groups, we had a lot more success. There's a bigger population that you can reach at once. However, I realized that I was deficient in planning the programs and evaluating the needs of the employees. So returning to school at UGA to the MPH program made sense to me to develop those technical skills.
Well, tell us about your involvement now with Dr. Mark Wilson and the Workplace Wellness Group.
Working with Dr. Wilson on several research projects that we have to do data collection on the health status of employees in several organizations, as well as create online education modules for public health professionals in the state of Georgia to learn more about workplace health.
So now that you've got this new experience and these new technical abilities, how will this program help you prepare for a career in workplace health?
Well, before returning to school, I was working for a health promotion company and realized that I was deficient with program planning and evaluating the needs of employees. I could talk to people about their health, but didn't quite grasp the big picture of workplace health. And through the classroom knowledge, I feel much more prepared to do needs assessments and plan programs, but also working with Dr. Wilson in the Workplace Health Group, I have the real-world application at the same time, so I feel much more prepared to do the things I mentioned before.
Well, after graduate school, back to the real world, what are your plans now?
I plan to do workplace health consulting, so help organizations evaluate the needs of their employees and work with the organization to plan programs that can help their employees and coworkers live healthier lifestyles.
Okay, well, thank you, Scott. And this is just another example of how the University of Georgia College of Public Health is working to improve the health of the workers in the workplace. Kendra Houghton is the wellness coordinator for the Athens Clarke County government. Kendra, welcome to PHI. We're pleased to have one of our alumni here on the show. Tell us about your work now with Athens Clarke County government.
Well, I moved on in September of 2009 to become wellness coordinator for Athens Clarke County government for the employee wellness program. We provide many different health and wellness programs and services for the employees, anything from monthly 5Ks and about 80 fitness classes per month, a fully functioning fitness center, all the way to many screenings throughout the year, a health fair, educational sessions, about 1 to 5 educational healthy hours a week, as well as risk reduction programs and many other services for our employees.
Well, that's a lot. Well, what kind of benefits are we seeing from this really wide-ranging effort?
First and foremost, our goal is to promote a culture of wellness within our employee population, a sense of community. We want our employees to be happy and healthy, enjoy their job, enjoy their coworkers and the situation that they're in, and bring that back to their families. We want to improve their productivity, make them better at their jobs, make them want to stay in their job, so therefore reducing turnover. But then also an underlying goal is to save the employee money by way of their medical insurance claims, prevent large stressful medical issues, and then in turn save the county money as well.
Beyond the benefits that you've already mentioned, what do you really see as some of the biggest successes that you've already seen?
We can give you so many different examples of employees who did not know that they were dangerously sick, who we were able to catch before they reached a very sick state. So for instance, we've caught many different issues by way of all of our screenings throughout the year, anything from skin cancer screening to mobile mammography to PSA and DRE screenings, to screen employees who may not necessarily go out of their way and be screened on their own time and on their own dollar. But then also through our various risk reduction programs, we're able to counsel employees through the very daunting, intimidating task of improving their health. Most people have no idea where to begin. So when we're able to provide services to educate them slowly but surely along the way, they become more confident to actually change their behaviors. We're also able to make some great comparisons through our health insurance provider, comparing those employees who participate in our wellness program regularly and those who do not have any involvement. And we've been able to prove that our wellness program participants cost a great deal less than those who are not actively participating.
This is really quite a success rate for the state, is it not?
Well, thank you. Yes, we are very fortunate to have the resources and the support that we do have. We have a very supportive mayor and commission as well as county manager who do what they can to provide us with the means to make the program work. We also are able to tap into so many different resources at no cost to us that are able to improve the health of our employees. We have been recognized by our health insurance provider as a great example to future clients of how to develop and effectively and efficiently run a wellness program that will actually save the county money or save the organization money and improve lives.
Tell me about the involvement with the university and with the Athens area people.
We tap into so many different resources and services within the University of Georgia. There are many different schools within the university who need to provide their students with a certain amount of experience in the community before they move on with their degree. And they provide that at a reduced cost for us because it's a win-win situation. We're getting the service at our work site for a reduced cost with great service, and the employee is not having to pay. The wellness program is covering that for them, and the university is getting that experience to their students that they need before they graduate. The most recent program we've become involved in is the UGA Workplace Health Group, and they provide the Fuel Your Life program for us. That is a diabetes prevention program. And currently we have about 75 employees working in that program in small group settings, going through health coaching to prevent the development of diabetes.
Well, Kendra, it's obvious from this that the Athens Clarke County Wellness Program is a benchmark for success throughout the state. If somebody wants to see and get some more information on this, where can you send them?
They can access our website, which is available for all of our employees, but also the general public. And it provides information on the setup of our program, all of our different program options, everything that we offer to our employees.
Well, thank you, Kendra Houghton, with the Athens Clarke County Wellness Program, example for the rest of the state and really the rest of the country, and how to protect the workplace health. So we've heard from the community partners and the workers and researchers in workplace health, and now we need to see Dr. Wilson back again. What does the horizon look like? Where are we going? Things are really changing right now. There's a lot of change on the horizon. Where's the workplace health group going to go now?
Well, one of the hottest issues in healthcare and health in general certainly impacts worksite health as well. The new Patient Protection and Affordable Care Act that was passed a couple of years ago, typically called Obamacare, has a section specific to workplace health promotion programs. And what it does is it allows companies to charge differential rates for their healthcare plans. So in other words, I could offer two healthcare plans, one of which that would be significantly cheaper to the employees than the other plan. The act originally was passed with a difference between 20%. So the maximum difference between those two plans could be 20%. It raises to 30% in 2014, and there's discussions in the federal government about it going upwards of 50% after that. The key is, in order to get into the cheaper plan, you have to meet certain criteria that are health related, and many of those are tied with worksite health promotion programs. You have to show that you don't smoke, for example. You have to have an annual physical exam with your physician to make sure that you're taking care of yourself. If you are found to have hypertension or high blood cholesterol, you have to be under the care of a physician and taking some actions to want to moderate that particular condition. So what it's forcing organizations to do, if they want to be able to achieve some of those benefits to offer the cheaper plan, they have to offer worksite health promotion programs for their employees. So more and more organizations are starting to ramp up and become interested in workplace programs for their employees, when maybe before they were less interested or less knowledgeable about the benefits of doing so.
What an interesting concept, to incentivize people and organizations to improve their health with financial incentives.
Well, clearly organizations have a financial incentive for doing so. The earlier example of the University of Georgia spending $100 million for their employees alone, 20% of that is certainly a significant sum. But there's also obviously a clear advantage to the individuals as well. When they're healthy, they're able to live healthier, better quality of life. And so in the long run, it's a win-win situation for both the organization as well as the individual. And that, as you well know, is the nature of public health.
And that's what we're about here, on the cutting edge of workplace health and improvement here at the University of Georgia College of Public Health.
It's wonderful to see that applied research can have such a big impact on Americans, specifically the Georgia workforce.
Yeah, and you know, Phaedra, the Workplace Health Group here at the University of Georgia has really added a lot to the scientific knowledge and credibility of intervening in the workplace to improve health.
You know, and I think as a College of Public Health, it's our responsibility to lead by example.
Well, we are a College of Public Health, which means preventing disease.
And so here's an idea. How about you and I start a Tai Chi program every morning? We'll be on the Health Sciences campus. People will be driving into Athens, and they see you and I doing Tai Chi every single morning. It could be a revolution of public health in this community.
Well, you know what will happen, of course, is people will stream out of the buildings. They'll say, look at them. Why would I want to sit here in front of my computer in the dark when I could be out there on the lawn improving my health? You know, that is what ought to be happening here and in all of these other workplaces. You know, that's what needs to happen.
Yes, I agree, Cham. And don't forget to join us next time when we talk about injuries and violence prevention on PHI Public Health Impact.